It's a fact. Every day, millions of Americans suffer debilitating back injuries. At any one time, 6.8% of the population is suffering from lower back pain. That's over 13 million people. People from all walks of life. Athletes, professionals, laborers, students, office workers, housewives. Back pain does not discriminate. At the same time, there are now thousands of people whose lives are no longer filled with the debilitating pain caused by lower back injuries.
It's been a real blessing.
Like a miracle.
People who have returned to their normal active lifestyles after undergoing a dramatic, life-changing experience.
All the things that I could do 5 years ago, I'm able to do now.
What do these people know that millions of sufferers need to know? They have discovered the only natural, drug-free cure for lower back pain that does not require painful surgeries or useless physical therapy. They have discovered a revolutionary new technique that treats the cause of lower back pain instead of the symptoms, unlike many conventional treatments. If you are now experiencing lower back pain or have ever suffered from lower back pain, what you will learn in this next 30 minutes could forever change your life. You will meet Dr. Stephen Visentin, a nationally renowned pioneer of this state-of-the-art technique, who has given lower back pain sufferers a new lease on life. This could be the most important half hour you have ever spent. You'll never again have to say, "Oh, my aching back." It doesn't matter where you are in this country. 8 out of every 10 people have at one time in their lives suffered from lower back pain.
There was an accident involved, a car accident.
Well, I was involved in a near-fatal accident.
Stress and strain, wear on the body.
Pain from polio.
I sat in the car 8 hours a day, 5 days a week.
I had been diagnosed with MS.
A near-fatal car accident.
I was in a car accident.
Got a curvature of the spine and the vertebrae were out of alignment.
Who are these people? They are people you know and those you don't. They are everyday people and famous people. They are your neighbors, your friends, your co-workers, your family members. They're you and me. The one thing they all have in common is finding an effective way of dealing with lower back pain, which to many sufferers is next to impossible. Kelly Preston was one of those people. Kelly never realized what a nightmare chronic back pain could be until she was injured, lifting her 5-year-old daughter. From that moment on, Kelly's life was nothing but one frustrating attempt after another to find someone or something to help her end her suffering. After countless trips to the doctor, several prescriptions for potentially harmful drugs, and wasted time with a physical therapist, Kelly made the call that changed her life. She called Dr. Visentin at Care Chiropractic.
So how did this begin?
It was nothing major. I just went over to pick up my little girl, and I got this sharp pain in my back.
Could you show me where it is?
It's right down here.
All right. Does it radiate down your leg at all? Does it give you leg pain?
Oh yeah, it's going all the way down below my knee.
All right.
I can't do anything.
What have you tried for this?
I had physical therapy. They put me on pain pills, but I can't really be on them because I have a little girl.
Okay, did you try acupuncture and other techniques as well?
Oh yeah, I've tried everything.
Rehabilitative care? And how does that work? How's that working for you?
It's not really working at all. I still have this pain in my back.
Okay, it sounds like they haven't gotten at the cause of your problem or really addressed the cause of your problem. Oftentimes, people will go from doctor to doctor and try everything to get out of the kind of pain that you're in.
I can't do anything. I can't drive. I can't play with my little girl. I can't even sleep right. It's just affecting my entire life. I didn't think it would. It's just not the same. I'm in constant pain, really excruciating pain.
I want to let you know that you're in the right place. We help these kinds of problems all the time. And I want to let you know we're not just going to cover it up with drugs or some other form of treatment. We're going to get at the cause of the problem. Oftentimes, bones move out of alignment in the spine and pinch on the nerves that supply the leg, and that's why you're having discomfort. Physical therapy, pain pills, acupuncture, hot, cold, therapeutic exercise. They never address the cause of these problems. At our center, we do a special examination to find out what the cause is and remove the cause so that you can start the process of healing.
What would be the cause? I don't know.
You might have a vertebra that's out of position in your spine. In other words, a backbone that's out of place, pinching on the nerves that supply your leg.
So what's physical therapy doing? Just addressing the pain, or?
You can imagine, if the bones are out of place in the spine, until they're lined up again, you won't be well. And putting heat on them or putting cold on them Well, that's not going to straighten anything out. Or drugging up the problem. It's just a cover-up. It will never address the cause. What you really need to do is get your spine aligned. And we do a gentle technique. It doesn't hurt a bit. Gets tremendous results with problems just like these. Oftentimes, people have been everywhere else, they've tried everything else, and they continue to get worse or they don't get anywhere. And I want to let you know you don't have to live like that. You could live a better life and you could get out of pain rather quickly. We do a special technique. It's completely painless, state-of-the-art technique that lines the bones up and gives a lot of relief for these kinds of problems when other techniques have failed.
How long have you been doing this?
I've been in practice over 15 years now, and we hold the highest rating in this special technique. It's called the activator method. It gets dramatic results with discal protrusions or the so-called slip disc.
Is it
People often
painful?
call it slip disc.
Will the procedure cause me any pain?
No, no discomfort whatsoever.
Okay.
It's painless. You'll be amazed. You'll come off the table and you'll be amazed that it feels like a click. It feels like nothing. And over the days and weeks, you'll notice steady improvement in your condition.
Great.
We're getting 95% improvement, 95% success rate with cases just like yours. Oftentimes, patients will come in with tremendous lower back pain just after lifting up something trivial like a piece of paper. They'll just bend over, or they'll cough or sneeze and notice that something isn't right, and they're not able to stand up right again. They're not able to stand up erect again or hold themselves erect. And they'll notice numbness and tingling down their leg. And this is called a slip disc, or more accurately, more scientifically, a discal protrusion or discal prolapse. It's not just people who are involved with using their bodies for their living. It's not just construction workers or the athlete. It's virtually everyone. In fact, if you're not in good physical shape, you're more prone to lower back pain. Characteristically, our patients have been everywhere else, and they've tried everything else. They've had all the drugs. Some of them have even resorted to surgery. And as you might know, surgery has very poor results with discal problems. Even the best surgeons, the best neurosurgeons in the country are reporting just 50-50 results. In other words, 50% get better and 50% fail. We don't prescribe drugs and we don't perform surgery. Now in America, there's over 500,000 surgeries done for discal conditions every year with oftentimes disastrous results. And I'm reaching out to people through this infomercial to let people know that there is a better way, that they can get well naturally without the drugs and without the surgery. And certainly there's a time and place for drugs and surgery, but not until you've tried everything else first. I say chiropractic first, drugs second, surgery, that's the last thing you want to do. You're not going to be any healthier after they take pieces of your body out, after they rip pieces of your body out or chop pieces of your body out. You're not going to be any healthier. There are no spare parts in the human body, let's face it. So the human body has a tremendous propensity to heal itself. This is a self-healing organism, and if we take care of it and we live lives with proper balance and in accordance with nature, we'll get along a lot better. So our system of healing has to do with balancing the body. A lot of people think it might hurt to get chiropractic care, and they're very afraid that it might hurt, that we might twist them up and they'll become pretzels. But that's just not the case at all. If you watch this video, you'll notice that we use very gentle methods that are very safe. In fact, state-of-the-art health care. Our patients report that they feel a click, that they hardly feel a thing. And we gently realign the spine using a special handheld instrument that produces a controlled amount of force, enough force to realign the vertebrae and take the pressure off the nerve system.
Just what is this pain-free treatment that Dr. Visentin utilizes to treat lower back pain? What can be so simple and yet so effective? In just a moment, you'll discover the secret which has changed the lives of literally thousands of people. If you have a lower back injury, waiting for it to get better is dangerous. Your problem may get worse, doing permanent damage to the spine and nervous system. Don't wait. You can feel better today, and feeling good is what life is all about. Call Dr. Visentin at CARE Chiropractic for a free exam now at 394-CARE. If he cannot help you, he will tell you so. Relief is just a phone call away. Just pick up the phone and dial 394-CARE. Call now. 394-CARE. That's 394-CARE. You have nothing to lose but the pain. It's often common for first-time patients at CARE Chiropractic to be skeptical of a fast, pain-free method of treating their lower back pain. And who can blame them? Many patients see Dr. Visentin only after they've tried painful physical therapy and potentially harmful drugs, and have been told that dangerous surgery is the only alternative. Dr. Visentin, on the other hand, is a firm believer in the most natural way of healing a body, and that's by allowing the body to heal itself. Dr. Visentin calls it turning on the power.
One of the first things we look at is how the person moves. We want to make sure that they're balanced, that they can walk upright, and they're not holding back in any sort of way. Oftentimes our patients come in with what's called an eggshell gait, where they're like walking on eggshells. And they can barely stand up, never mind stand up straight. They're unable to stand up fully erect. And when they cough, sneeze, or strain at the stool, they'll notice tremendous lower back pain. In fact, many times it'll radiate down their leg, and they won't be able to do anything. And this kind of pain doesn't get results with drugs. I want to let people know, if they're out there, they're taking drugs and they're trying everything. They haven't tried everything until they get the proper kind of chiropractic care. We do a state-of-the-art technique here that gets tremendous results with these kinds of problems. If you're at home, if you're miserable, if you're sitting on the couch and you're hurting and you're unable to work and you're unable to live your life, you don't have to live that way. And unless you change something in your life and decide to move ahead in a different way, and maybe a more natural way than the way you're going, it's not going to change for you. You have to do something different to get different results. We use a handheld instrument to adjust the spine. It's approved for use for Medicare and Medicaid by the federal government. It's a handheld instrument made of surgical steel that produces about 17 pounds of force. It's produced over 1/10 of a second, and it's enough force to gently push the bones back in position and alleviate pressure on the nervous system. This is a state-of-the-art technique. I've known the founder since 1982. I've been friends with the founder of this technique. He's a man who's spoken before Congress 3 different times, and he's up on the latest research, not only in chiropractic, but as in spinal type of care and spinal hygiene in particular. And I hold the highest rating that this technique offers doctors of chiropractic today. So we do a special method. It's called the activator method, and we have the advanced proficiency status rating at this center. We're very proud of that fact. In fact, we help teach other doctors this technique in the area. So Kelly, it looks like you're ready for your first adjustment.
Yeah.
I wanted to let you know this is completely painless. I know you're concerned that it might hurt, right?
Yeah.
Most people are. Anyway, put your hand out. I'll show you. This instrument is completely painless. You didn't feel a thing, did you?
No.
All right. Please, when you're ready, step up over here, and I'll take a piece of face paper out, and we'll lean you forward on the table, okay?
Okay.
You ready?
Yeah.
Here we go. So you'll feel yourself move forward on this table. And this table is designed to set you forward in the posture that you normally assume. And I'll do some special checks on your back to determine where you're out of alignment and what can be done about it, okay?
Okay.
What I'd like you to do is just relax, bring your arms to your sides. And I'm going to lift up your legs a couple of times just to make sure you're relaxing. Let your feet relax all the way. By the way, did you know that you have a left short leg?
Nope.
Your left leg is much shorter than your right leg. There's imbalance in your spine and in your nervous system that could be causing every bit of your problem. So I'm going to do a special test to determine when to adjust you, and that means to put the bones back in position.
Okay.
You have a vertebra that's out of alignment right here. Can you feel it?
Yeah.
In fact, it's pinching on the nerves that go down your leg, and that's what caused your leg pain or the numbness and tingling that you feel in your leg.
Okay.
So what I'm going to do is use the handheld instrument to adjust your spine, create balance so that your body can better able to heal itself.
All right.
So we'll go ahead and set the bone back in position. Now, did that hurt at all?
Oh, no.
It was easy, wasn't it?
Yeah.
All righty. Anyway, it's certainly a lot easier than the pain that you've been through. Your feet are even, Kelly.
Right.
That looks beautiful. You did wonderfully well for the first adjustment.
Good.
So an adjustment puts the spine back in place. I'm going to pull on your spine a little bit and traction out the muscles so that you can relax. I want you to take in a deep breath and just blow out some of that pain that you've been experiencing. Just let it go all the way. How does that feel, Kelly?
Oh, it feels much better.
Alrighty. I know you've been through a lot of discomfort, and these muscles are awfully tight. It's going to take you time to get well, but you adjusted extremely well today, so I'm very optimistic about your case.
Oh, good.
We have a 95% result rate at our center with this technique. It's completely painless, it's state-of-the-art. It's one of the fastest growing techniques in chiropractic today. Gets dramatic results with problems just like yours.
Great.
I'm going to lift you up now. Are you ready?
Uh-huh.
So you'll feel yourself move up in just a second. Here we go. So I'll lift you upward, and you'll feel yourself move up, and the pressure will build on your spine once again. When you're ready, take a step back, please. So Kelly, how does that feel?
Oh, much better.
You did great. I'm
Thanks.
proud of you. You did wonderfully well. Oftentimes, if the problem is new and the pain just came on recently and the person's relatively young and they haven't had the problem before, they'll get well very, very quickly within a few adjustments. An adjustment means to gently realign the spine and put the bones back in place. And we get at the cause of the problem so that the problem doesn't come back at a later time, so that the spine doesn't decay. Because if the bones are out of place, that leads to decay. It leads to rotting of the spine and serious interference with the nervous system, and oftentimes permanent damage to the spine and to the nervous system. So what we do gets at the cause of the problem. It gently realigns the spine so that the body can heal itself. Oftentimes people feel so good after the care that we provided that they want to continue. They just want to feel good and stay feeling good. And I don't blame them one bit, especially after what they've been through. So they'll maintain their health with regular, what we call adjustments. An adjustment means to put the vertebrae or the backbones back in alignment. It's painless and it does feel good, so they come back again and again.
Dr. Visentin has enjoyed tremendous success with the Activator method, but the best testimonials come from those who have benefited most, Dr. Visentin's patients. In just a moment, you'll meet several of Dr. Visentin's patients whose lives he has improved so dramatically.
The more he clicked, the better I felt. And when I walked out of there, it's like a miracle.
You've heard from Dr. Visentin about the Activator method and how this pain-free treatment has helped thousands of people who have suffered from lower back pain return to their active, pain-free lives. People who had tried every other form of treatment without any success. Now, we want you to meet these same people and hear about this miracle cure in their own words.
Well, I came because I was in a lot of pain, and I was having neck pain, headaches, lower back pain.
Well, I had severe back pains, neck pains, my shoulders, down my legs.
I was just in a lot of back pain and nothing was helping. I was going through physical therapy. That just wasn't helping.
The pain was down the back on the side that was most affected by the polio. Then it began spreading to the left side because of the compensation I was doing. And I began to shut myself off. I'd always been a very active person. After polio, when I began to recover, I learned to ice skate. But when I hit post-polio syndrome, I could no longer do these things. And it was frightening. I'm not ready to be old.
I did see someone for some physical therapy, but in the end it made it hurt worse because they didn't correct the problem. They only, I mean, I got bigger muscles, but, the pain was still there. And of course the doctor, again, just wanted to give me more pills.
I had been diagnosed with MS about 8 years ago, and it has through the years gradually gotten worse and worse.
I was taking the aspirin, the Tylenol, the ibuprofen.
My eyesight was good looking forward, but then when I went sideways peripheral vision, it was leaving. And that scared me, so that's when I came in.
Well, we took x-rays and he diagnosed my problem, and he put me on the table and he adjusted my back and put the vertebrae back in place.
I didn't think that a little instrument like that would be able to really relieve my pain, but it did, so I'm very impressed with it.
Well, he just used the tool, and he came out and showed me on one of his other patients how the tool worked and how he put people back into alignment. And when he used the tool, it was virtually painless.
Actually, I didn't know what to expect, but I was expecting maybe him to crush my bones or to hurt me or to do something. And instead, he showed us a film regarding the spine and how it works and how it gets out of alignment. And then he used this little bitty tool that actually was very painless.
I was very skeptical. His assistants met with me, and I wondered why everyone seemed so caring, what kind of an act that it really was. And I was amazed to find out as I came back each visit, this was real. These people cared. And even though I didn't believe in it at the beginning, it was really helping.
Every time it clicked, I felt something move. And every time something moved, it didn't hurt where he clicked. And I'm like, wait a minute, that didn't hurt. So the more he clicked, the better I felt. And when I walked out of there, it's like a miracle.
In 1990, I had a lot of back problems, and we had 2 world titles on the line. And it was really neat because it came in and got adjusted on a regular basis. And I stayed healthy the whole entire time, and it was 2 of the best fights I've ever had. You know, won both tournaments. But I mean, it was really incredible because I went into there pain-free, which was a first for me.
I have tried, I'll be truthful, other chiropractic, but nothing works as well as the activator method.
He's been able to adjust the spine or the vertebrae that happen to affect the area where the pain is, and that has been able to relieve the source of my pain.
He gave me an adjustment in the neck. The neck area was out really bad, and it had something to do with vision. And at the time that he gave me the adjustment, I mean, it felt good. And it was early in the morning, it was about 10 o'clock, and then by about 3 o'clock, all of a sudden I told my sister, I said, you know what, I can see. I'm being able to see. Not only could I see the peripheral vision, but forward was, you know, I could see a lot better.
This summer I started playing golf for the first time in years, you know, and I couldn't really do that before. So, you know, I'm really, you know, happy with the results. It's been a real blessing.
What I appreciate most is he listens first to find out what's going on, and then he proceeds with the treatment.
Physical therapy only lasted an hour or 2, and then it was right back to the same pain. And after leaving Dr. Vicentin's, I felt 100% better.
Well, amazingly, I felt better. I was shocked by that, even that I felt better, even with the first visit.
I received activator treatment, and when he first showed that to me, I didn't believe a thing. And even after the treatment, I walked out and I thought, I know this isn't going to help. But as I walked to my car, I thought, I really feel like I'm standing straighter than I have in weeks. So I came back.
Very often, people who come to us are depressed. They've lost their lives in one way or another. They're not functioning the way they could or should. They feel remote or removed from their family because they're not able to take on the roles that they've had before. For a man as a provider, for a wife as a caregiver of her children, that these kinds of problems virtually immobilize people. And they come to us, and in spite of what they've been through, the amount of pain that they've been through and suffering, and in spite of all the specialists that they've seen and the drugs and the rehabilitative care, they begin to get well, and then they get excited. They get excited about themselves and their life, and they regain their self-esteem in a lot of ways because they know that healing is real, that it's not something from the outside in, not something outside of them in the form of drugs or some kind of therapy that's applied to them, that it's a real change that's coming from them, that comes from balance from within, that their bodies are actually healing themselves, that those sick cells are being replaced by healthy ones, and that's everything. So they get excited, and we get excited too.
I look at the long-term effect, you know. I want to be pain-free and not get old and you know, walking with a cane. It does make a difference.
I don't know exactly how it works or why. I wish I could tell them more of that, you know, but it has helped me. And a lot of course, medical doctors just kind of go, oh yeah, you know. But most people I tell, listen, because I think intuitively we know that there's something to it. And especially when people see that I can walk better.
Yeah, it's just an amazing process. And he's never wrong. That's the real incredible part. You know, he'll tell you to move which way or that way, and then he can tell, you know, right away what the problem is.
I'm feeling a lot more positive each time I come in. In fact, I'm looking forward to coming in because I know that when I leave, I'm going to feel better.
I couldn't walk my dog around the block when I came in February. Last Sunday, I met with a group of friends, and we took a 3-mile walk in the mountains, and I survived.
You've got to come down and try chiropractic care. It works for me.
All the things that I could do 5 years ago, I'm able to do now.
I haven't been here too long, but I'm here for life.
You don't have to live this way. You can live a better life, but not with drugs, not by covering it up with painkillers or physical therapy. Oftentimes we see people who've wasted weeks or months of their life with ineffective care, and I don't believe in that kind of loyalty. If the doctor you're with or the therapist you're with is not giving you the results, it's time to make a change and reach out for a better way of life. And this is a wonderful way to do it because it's drug-free, it's natural, there are no side effects, and it's very, very safe.
In the last half hour, you've heard from Dr. Visentin about the activator method and how it is proven to be one of the safest pain-free treatments for lower back pain. You've heard testimonials from former sufferers who had tried all other methods of treatment before discovering Dr. Visentin and the activator method. Now they are pain-free. Now, if you suffer from lower back pain and want to return to your pain-free active lifestyle, then pick up the phone and call CARE Chiropractic for a free exam. Make an appointment to see Dr. Visentin and discover how well the activator method can work for you. The only thing you have to lose is the pain in your lower back.
We work with insurance companies all the time. Most insurance covers chiropractic care. If you've been involved in an accident, for example, if you've been involved in a car accident, oftentimes at our center you'll pay nothing for your care. Where there's no coverage or little coverage, we're very affordable, and we work hard to make it affordable for the patient to come here. I believe that healthcare should be, number one, effective, and number two, affordable. If it's not affordable, then what good is it? So we're billing for insurance here. We'll do all the paperwork for the patient, and we'll work with them until their spines are balanced and their nervous systems are freed up and they're living a different kind of life.
If you have a lower back injury, waiting for it to get better is dangerous. Your problem may get worse, doing permanent damage to the spine and nervous system. Don't wait. You can feel better today, and feeling good is what life is all about. Call Dr. Visentin at CARE Chiropractic for a free exam now at 394-CARE. If he cannot help you, he will tell you so. Relief is just a phone call away. Just pick up the phone and dial 394-CARE. Call now. 394-CARE. That's 394-CARE. You have nothing to lose but the pain.